Not long ago, Denver Public Schools nurse Rebecca Sposato was packing up her office at the end of a difficult school year. She remembers looking around at all her cleaning supplies and extra masks and thinking, "What am I going to do with all this stuff?" It was May, when vaccine appointments were opening up for the majority of adults and the Centers for Disease Control and Prevention were loosening mask guidance. "I honestly thought we were trending down in our COVID numbers, trending up in our vaccine numbers," she says. "And I thought the worst was over." Now, 4 months later, the pandemic is already upending the new school year across the country, as the highly transmissible Delta variant continues to cause a spike in cases. In Arizona, coronavirus outbreaks are forcing thousands of children and teachers to quarantine. In Georgia, many districts that began classes in person without mask mandates switched back to remote learning after the virus spread. And in Oregon, some districts delayed the start of the school year after teachers were exposed to possible infection. School nurses are tasked with caring for the health and safety of children at schools, and managing a third school year in a pandemic has put even more strain on those in a profession already facing staffing shortages. Katherine Burdge is a school nurse in Tampa, Florida, where classes started at the beginning of August amid a struggle between school districts and Governor Ron DeSantis, who threatened to cut state funding for public schools that required students and staff to wear masks. A judge ruled that DeSantis' executive order banning mask mandates was unconstitutional, but Burdge says school nurses are dealing with the repercussions of the back and forth. Her district of Hillsborough County had to isolate or quarantine more than 13,000 students and staff in just the last month, over 2,500 of whom tested positive for the coronavirus. "We're dealing with COVID on the front lines every day," she says. "It's a serious manifestation that is just overwhelming the district, the state, everybody." Eileen Gavin, a school nurse in Monmouth County, N.J., also says it's been overwhelming and cites a beat-up and faded parking for school nurses only sign as a visual representation for how she and other school nurses are feeling. "It's kind of like Groundhog Day, another year of contact tracing and vaccinating and kind of leading the kids back to school safely," Gavin says. "So, I do think we are traumatized." Gavin says nurses continue to show up and do their jobs, but are feeling the strain of a workload that has expanded beyond what they could have predicted. "It really is a lot to bear," she says. "We are the only healthcare professional in the schools and we have input and weigh in on so many things." Gavin says she spends a lot of time talking with parents to help them sift through the noise and the misinformation and give them valid resources on dealing with the coronavirus.